identified as accident causes. Some will be seen as minor or contributory factors, and others will be identified as key or major accident causes. When we look closely at these factors, it becomes clear that they can be categorized into two distinct groups. The first group can be classified as unsafe conditions and includes such things as untidy work areas, faulty equipment, slippery floors, and inadequate lighting. The second group of factors can be classified as unsafe acts that result from people's behavior. For example, not following safe work procedures, the inappropriate use of equipment, or the failure to wear required personal protective equipment. Of these two groups, statistics prove that unsafe acts are by far the most significant. Simply put, unsafe acts are recognized as the key causes of most accidents. So it naturally follows that if we can significantly reduce the number of unsafe acts that occur in the workplace, we will also significantly reduce the number of accidents. Traditionally, unsafe acts have been controlled mainly through the implementation of training programs and the establishment of safe work procedures and practices. However, despite these efforts, unsafe acts continue to be a major factor in the majority of workplace accidents. The reason unsafe acts are so difficult to control lies in the fact that, unlike unsafe conditions, unsafe acts involve the human factor. That is, they occur as a result of people's behaviors and attitudes. By adopting a behavioral approach to safety, which must be used in conjunction with traditional control measures, the human factor, and therefore unsafe acts, can be effectively addressed. This approach is known as behavioral safety. Behavioral safety aims to reduce the incidence of unsafe acts by modifying people's behavior and improving their attitude towards safety. Because behavioral safety is essentially about reducing the occurrence of unsafe acts, it is important to clearly define what an defined as an intentional or unintentional violation of an established safe work practice, procedure, or method. The most common causes of unsafe acts can be categorized under the heading of acts of indifference. In these situations, safe work methods are known but aren't followed. For example, personal protective equipment is not worn, or correct manual handling techniques are not used. Other causes of unsafe acts can be categorized under the heading of a lack of knowledge, the main sources of which are inexperience and poor or insufficient job training. This takes into account situations in which people perform jobs they're not trained, certified, or authorized to carry out. An example of this would be the unauthorized entry into a confined space. In addition to these causes, there are a number of other factors that can contribute to the occurrence of unsafe acts. These include lack of concentration, physical limitations of individuals performing specific job tasks, fatigue, haste, laziness, clowning around, loss of emotional control, and altered states of consciousness resulting from medical conditions or use of drugs and alcohol. Regardless of the underlying reasons for unsafe acts occurring, the justification for them is frequently couched in terms such as, "It's too complicated," "It takes too long," "It's outdated," "It doesn't apply to me," "It's wrong," "It's unnecessary," or "It's just as safe doing it the way I've always done it." It becomes clear then that addressing the issue of unsafe acts has a lot to do with changing people's attitudes towards safety and getting them to commit to following safe work practices and procedures all the time. But how can this be achieved? According to behavioral safety, the way to change a person's attitude towards safety is to change the way they choose to behave. But what exactly is behavioral safety, and how does it work? Well-recognized theory of behavior modification, which states that a person's behaviors and attitudes can be modified and changed using positive reinforcement. Positive reinforcement is a technique that uses feedback and discussion to establish positive consequences for improved behavior. In the context of behavioral safety, feedback and discussion should establish sound reasons why particular job tasks should be performed differently to improve safety. The theory of behavior modification can best be understood using the ABC model. A represents the antecedent event that triggers behavior. An antecedent event is the cause or event that precedes behavior. B represents the behavior the person chooses to take, and C represents the consequence of that behavior. Manual handling is a good example of a workplace event that can affect people's behavior. Applying the ABC model, the item that needs to be moved would represent A, the event that triggers behavior. The person's choice regarding how to lift or move the object would represent B, the person's behavior. Whether the person's behavior places them at risk or not would represent C, the consequence of the person's behavior. The critical variable is the person's choice to act in a particular way. According to the theory of behavior modification, whether a person chooses to behave in a particular way or not depends on the consequences of that behavior. If the consequences are positive, then the behavior is more likely to be repeated. If the consequences are negative, the behavior is more likely to be avoided. In behavioral safety, positive reinforcement is used to establish positive consequences for safe behavior, so that in specific job situations, people choose safe behaviors instead of at-risk behaviors. This can be achieved through the implementation of a behavioral. The next component is the observation process. A behavioral observation involves observing an individual or a team of people while they perform a job task. The behavioral observation process has 3 steps. The first step is to select a job task to be observed. The second step is to inform the person or people involved that the task they're performing is going to be observed. And the final step is to conduct the observation. The purpose of the observation is to determine what is being done safely and what is at risk or unsafe behavior. Observation should be conducted on a regular basis and address all the at-risk behaviors that have been identified and listed as potential accident causes. And the final element of a behavioral safety program is the feedback and discussion component. Feedback uses information from the observations to bring about change in people's behavior. For example, if a person is using a hazardous substance and is unaware of its potential dangers, a sound explanation of the hazards and how the substance should be handled is likely to impact on how they will deal with the substance in future. Conducted regularly, observations followed by appropriate feedback and discussion emphasize the importance of safe behaviors and reinforce the need to perform job tasks safely. A behavioral safety program is most effective when everyone involved is adequately informed about all aspects of the program, when communication between all parties is open and honest, when the focus remains firmly on safe and unsafe behaviors, when people's names are not recorded as part of the observation process to ensure anonymity and avoid blame being attributed, when the people involved are not disciplined as a result of an observation, but rather are encouraged to act safely, and when people contribute genuinely to the running of the program and the observations. Behavioral safety is not a quick fix to improved safety performance. It is an ongoing process that needs to be systematically applied and integrated into normal workplace activities. It is also clear that a successful behavioral safety program can only operate in an environment that already has in place established safe work procedures and practices, adequate job training, access to safety information, and, most importantly, a mechanism in place to identify and control unsafe conditions. A behavioral safety program will inevitably identify existing unsafe conditions And if there is not a clear and separate process in place to deal with these situations, the purpose of the behavioral observation will deteriorate into a safety observation. Behavioral safety is not a replacement for other safety measures. It is rather an additional activity that, if managed properly, can be used to improve safety performance and build a better and safer workplace.